Now let's learn about health literacy and the older adult learner. The objectives of this lecture are to consider the trends and impact of AOTA's Centennial Vision for older adults, identify the tasks, roles, and potential opportunities for older adults as lifelong learners, consider and apply older adult learning needs to evaluation, intervention, and program planning and outcome assessment. Describe effective teaching strategies for community-based settings, home care, and senior centers. Examine the effects of health literacy on client and caregiver education and training to promote and facilitate skills in areas of occupation, prevention, health promotion, and safety. And to be able to design handouts and educational tools that will meet the needs of older adults and facilitate improved health literacy. So, what considerations are involved in creating a successful teaching or learning tool or session with older adults? Consider what are the barriers or challenges, and what are the positive factors we should be targeting? The special considerations of older adults. Think about decreased processing levels, sensory changes that older adults experience that you learned about in the beginning of the semester, personalities. Are they resistant to change? The pace of the presentation, literacy, language barriers, and cultural background. In terms of culture, you need to familiarize yourself with varied cultural backgrounds that you might be working with at specific settings or locations. Understand the role of the elderly in that culture and what expectations of elders that culture has. We cannot be completely culturally competent. We're learning that, right? That there's no way to be completely competent in every different culture. However, we can be culturally aware. Health literacy, as defined by Healthy People 2020, is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Health literacy includes the ability to understand instructions on prescription drug bottles, appointment slips, medical education brochures, doctor's directions and consent forms, and the ability to negotiate complex healthcare systems. Health literacy is not simply the ability to read. It requires a complex group of reading, listening, analytical, and decision-making skills, and the ability to apply these skills to health situations. Health literacy varies by context and setting and is not necessarily related to years of education or general reading ability. A person who functions adequately at home or at work may have marginal or inadequate literacy in a healthcare environment. With the move towards a more consumer-centric healthcare system as part of an overall effort to improve the quality of healthcare and reduce healthcare costs, individuals need to take an even more active role in healthcare-related decisions. To accomplish this, people need strong health information skills. Health literacy goals include increasing internet and mobile access, monitor and improve quality health websites, increase marketing of health disease and prevention, increase the use of health management tools, and health communication, strategies to support and improve patient-provider communication. Just this past spring, Dr. Simon and I had the opportunity to lecture to medical students about the importance of catering to different health literacy skills of older adults in the medical model system. The medical students were so eager to learn and appreciative of this information so that they could better provide services for their clients. What health literacy tasks are crucial for older adults? Many of them I already mentioned, but let's go over again. Retrieving prescriptions and referrals, selecting providers from a list of names and addresses, calculating when to take multiple medications, interpreting medical technology and terminology, comparing different insurance plans, and sifting through a myriad of health-related information available in magazines, on the internet, and on television are just a few of the complex thought processes that are involved in selecting, understanding, and using health-related information. Health outcomes and health literacy. Low health literacy is linked to poor health outcomes. It impacts preventative services and healthcare accessed by older adults. Reporting their health as poor is a health outcome of decreased health literacy and more likely to lack health insurance. Older adults and literacy skills. The National Assessment of Adult Literacy showed that 71% of adults over 60 had difficulty using print materials. 80% had difficulty using documents such as forms and charts. And 68% had difficulty interpreting numbers and doing calculations. The skills needed for health literacy include oral and decision-making skills, evaluating information credibility and quality, analyzing risks and benefits, calculations for medication dosages, interpreting test results, and locating health information. Individuals need to be visually literate, computer literate, information literate, and numerically literate. This is a visual for you to review to summarize health-related print literacy. Healthcare providers need to assist in locating information for clients, understand how to provide useful information and services, decide which information works best for varied circumstances and situations, process what clients are asking for, and be culturally aware. Cultural awareness considerations. Think about the use of interpreters or translators for both oral and written communication. Consider what the guidelines dictated by culture are: who, where, when, and what. And use of jargon. Always be careful about how much medical jargon or even OT jargon that you're using with clients. Here's the use of terminology that I was just targeting with the discussion about jargon. What do the following terms mean? Adequate, several times a day, frequently or often. Avoid the use of these vague terminologies. That way, clients have a perfect and clear view of what is expected of them when they are either using a medication or booking appointments, etc. Please review these different resources for health literacy tips. The education models used for didactic interaction, group education models, e-health models, and considerations. Consider community practices utilizing client-centered focus in a naturalistic setting. Clients have the decision-making abilities and choices to imitate or sustain their learning. We need to be concerned about the boundaries and ability to get too involved when elders look to you for support. Due to isolation and loneliness being problematic with elderly, we must always keep that in the back of our minds. A group education model, the formats may vary from highly structured to unstructured environments. Group topics may change, such as lecture series or having a routine course or consistency. There are many benefits to a group model, such as the need to consider various levels of functioning of group members and benefits of members gathering to meet divergent goals. Caution in that older adults do sometimes resist identifying with others of similar age or physical status. The cost of this resistance is often increased isolation. Benefits that happen in groups are the shared learning and the consideration for different learning styles. The ability in a group for the increased recall and interaction with the information being taught is definitely a benefit for that reinforcement and retention of the information. There are different teaching methods such as lectures, discussion, simulations, and handouts and visuals. These are all things that you should consider as you start to think about your program proposals that you'll implement in the fall. Advantages and challenges getting older adults connected. Let's discuss some of these. There are useful strategies to improving older adults' connectiveness. So presenting information slowly, allowing more response time, repeating information in several modalities, such as using handouts and visuals, allowing individuals to set their own pace, encouraging individuals to think aloud, and the need to compensate for any different sensory declines they may be having. Some different teaching strategies for older adults. Communicate with respect, acceptance, and support. Consider timing of teaching and learning sessions. Use the teach back technique. Link new information or skills to past experiences, and stay practical and relevant. Different hearing considerations. Think about if you need to modify the environment. Consider your rate and your pitch, the distance that you're speaking to the older adult from. Consider the size of the group and the availability of amplification devices. Some helpful hints and strategies. Make sure you have the client's attention. Speak slowly, clearly, and you do not need to shout. Write any messages for additional clarification. Using nonverbal communication and gestures. Check to see if the hearing aid is functional and adjusted. If the person does not understand, repeat by using different words or paraphrasing rather than repeating word for word. Visual considerations. Things you need to think about. Is there adequate lighting? How can I reduce the glare? Avoid color coding when safety is a factor. Avoid abrupt changes in light. And use large print for signs, directions, and labels. Environmental considerations. Maintain a distraction-free environment. Think about the lighting, accessibility concerns. Acoustic materials can be used near noisy traffic areas. And consider noise and traffic in treatment and meeting areas. Compensation techniques using touch for communication. Use of touch as a means of communication and orientation. Making physical contact easier and it actually increases input from other senses, such as sight and hearing. Sit close to the client. Avoid sudden, unexpected changes in body position and space. Allow sufficient time after changing position. Sensory stimulation should be incorporated into different rehab programs. Oral communication strategies for patient teaching and education. Sessions, 10 to 15 minutes for teaching sessions. Limit content to 3 to 5 main points. Specific and concrete points. The client should repeat the instructions. Repeat key points frequently. Summarize essential points and encourage others to be present, such as family and caregiver education if appropriate. Teaching and learning tools. Improving written communication. Start with a summary of essential points. Use upper and lowercase letters. Start each section with a heading. Use size 14 to 16 point font with plain types of fonts, no scripts or italics. Use black ink on white or buff no glare paper. Use simple line drawings of age-appropriate subjects. Avoid charts with rows and columns. Use lots of white space. Bold key points. Number steps in sequence. Use an active voice. Provide pencil or pen to encourage note-taking. End with a summary of the essential points and read and review written instructions with the patient. So finally, let's summarize teaching considerations. What are the advantages and disadvantages of a lecture? How do you distinguish a standard lecture from an interactive lecture? When is a discussion of the teaching strategy of, when is a discussion the teaching strategy of choice? What is a simulation? Describe different kinds of simulations. In what way is a simulation able to achieve effective objectives more easily than a lecture? How do these teaching strategies relate to one's teaching styles or preferences, or the learning styles and preferences? Pictures closely linked to written or spoken text can, when compared to text alone, markedly increase attention to and recall of health and education information. Pictures can also improve comprehension when they show relationships among ideas or when they show spatial relationships. Pictures can change adherence to health instructions, but emotional response to pictures affects whether they increase or decrease target behaviors. All patients can benefit, but patients with low literacy skills are especially likely to benefit. Patients with very low literacy skills can be helped by spoken directions plus pictures to take home as reminders, or by pictures plus very simple worded captions. Practice implications include that educators should ask, how can I use pictures to support key points? Minimize distracting details in pictures. Use simple language in conjunction with pictures. Closely link pictures to text and/or captions. Include people from the intended audience in designing pictures. Have health professionals plan pictures, not artists. Evaluate pictures' effects by comparing response to materials with and without pictures. These are all things that you should consider when creating learning materials, lectures, simulations, activities for your older adult groups for this fall, and of course, when you start practicing as a clinician.